So if you're suffering with pain on the lateral side of your knee, especially when you're running, then today I want to talk to you because you might be suffering from a condition known as ITB friction syndrome. So I want to talk to you about that today, and let's break it down into a couple of little simple things to begin with. So firstly, ITB friction syndromes are pains that occur in this lateral area of the knee, in this kind of area here, usually when people are running, especially after about maybe 3 or 4 Ks of running. So once we're getting up towards the 20 minutes, 30 minutes plus, this is when a lot of people will start to notice this. If it's really bad, some people will notice it immediately, even after a kilometre, may be enough for people to start noticing it. Other people may find when they're jumping or when they're squatting, they start noticing it. And the description of the pain is a burning, achy type of feeling that almost feels like there's a fire being lit just underneath the skin on that lateral part of the knee. So a lot of people start worrying about whether they have knee issues or similar, when really what we're talking about is a much broader problem than the knee itself. So to get started, our ITB is basically a layer of tissue, like a fascial layer that comes all the way down and attaches into the lower part of the leg. And what ends up happening is that it helps allow the leg to be moved out. So it allows for contraction to occur to shift that leg in an outward manner. So it has initially a first attachment towards the outer side of the leg itself, but we also have some attachment from your glutes coming into it as well. So when we get contraction, we get a pulling in this direction, but we can also get a pulling in that posterior direction as well. So really, as I said before, we're looking at a big tendon that goes from your hip through to your knee, and it does provide lateral support to the knee itself. It also helps the knee rotate to a small extent and also abducts, so moves the leg out. And really the whole ligament or the whole tendon is attached to your glute muscles, especially your glute max and the TFL muscle itself, often known as your tensor fascia lata. Okay, so what actually happens with an ITB friction syndrome is that if the muscles around that connect to it, so namely your glute and your TFL, start getting too tight and contracting too hard, an increase in tension in the tendon occurs, and the net result of it is we start getting this rubbing occurring down below in the knee itself, on the lateral aspect of the knee, which basically creates, exactly as the name says, friction over the knuckle itself. Over time, with repetitive friction, this starts generating inflammation. We lose the nice smooth surface, and now even small amounts of activity can set it off and create a lot of problems. So the typical people we see this with are people who get pain on use, as I was saying before. If it's bad enough, even squatting down and standing up, and sometimes even walking can be enough to aggravate it in some people. Pain on flexing and extending the knee. So if you keep your leg straight and move, it's not an issue. It's when we're bending and straightening the knee, that's when we start having this rubbing occurring as that tendon moves backwards and forths over the knuckle, and that's what creates the pain itself. And most commonly we see this in our runners, in people who are doing lots and lots of running. This is a really common problem. So one of the big key things we want to look at with this is not necessarily what's going on at the knee here, although we need to reduce inflammation down. And there's plenty of local treatments that we can use to do that. And there's also systemic ways we can do that through diet and through nutrition, as well as various supplements to help reduce that inflammation down, such as things like turmeric and fish oil and stuff like that. But really what we want to look at is, why is dysfunction occurring in this TFL up here and in the glute here? And there are a few key reasons why this seems to occur in some people. The first one that I commonly see is the quad itself. So the muscle we spoke about here last week. So when that quad is dysfunctional, we start using that TFL muscle more, and that creates an increase in the tension on the ITB. Likewise, a similar thing happens with the glute as well. And in some people, if we're unstable down here in the foot, that can create some rotational issues down there, and that can actually start creating some instability at the knee from a horizontal perspective, and that then creates further tension on the TFL. So what we kind of look at for these people are, number one, what's going on in the foot itself. Number two, what's going on in the pelvis and why is there dysfunction going through there. And then once we've got them resolved, then it's about how do we get that tissue healthy again, reduce that inflammation and encourage healing in a positive manner rather than a chronic inflammatory manner. Anyway guys, that's a quick introduction into ITB friction syndrome. It's a lot more complicated than that, but that'll give you a quick insight. If you're suffering with lateral knee pain, this is a common cause for it, especially if you're out and about running at the moment. So if you have any questions with that, just post them up. Otherwise, send me a message, and I'm always happy to help out you guys whenever you need some help. You know that. And I do that every single week, so don't be afraid to message me if you need to. And if not, I shall catch you in the next vid. Remember, it's all about adding years to your life, guys. Catch you later.